The title of our workshop is Beyond the Pelvis, Non-Invasive Conservative Care for Chronic Pelvic Pain, Bridging Evidence, Clinical Practice, and Access-Friendly Strategies. The goal of this workshop is really to empower clinicians to better understand the evidence behind some of our newer up-and-coming extrapelvic interventions such as dry needling, neuromodulation, modern pain neuroscience education, even orthopedic manual therapy, and exercise as a graded exposure. And this is to improve access to pain relieving treatments where there may be a geographic limitation, a difference in belief system, an age limitation, or just trauma-informed care to have strategies that complement our internal toolkit. We'll also present a clinical framework that's impairment-based to make decisions on which extrapelvic or intrapelvic strategies would be best for that patient and why.